Hi, everyone. This is Ben Thompson. I'm here on the Tinnitus Relief Podcast with George. We're going to discuss somatic tinnitus, whether to go and search information online on forums or not, different tips and tricks he's learned along the way. And George has come from a place of having challenging, bothersome tinnitus, and he's going to describe where he is today. George, give us a quick snapshot of where you are today and where you were at the worst of your tinnitus.
I just want to say thank you for having me on, Dr. Ben. Where I am today, I'm working, I'm living on my own, going about life and like living my life. And my tinnitus is still there. It's still there when it's pretty quiet. And, sometimes it fluctuates a bit higher. But overall, I'm just going about my day and doing pretty good. If you asked me this question about 8 months ago, I would say I was in a totally different place. My tinnitus was pretty loud because I kept fixating on it. And I was at the point where I was afraid to leave my house because I start becoming too afraid that any noise would further damage my ears and worsen my tinnitus. And that was all before getting in touch with Treble Health, being paired with Dr. Mark, and all the help he gave me along the way, which I assume we're going to be talking more about.
Yeah. Well, how about we could get connected and we want to share your story to give hope, to give practical advice, and to help someone else who might be going through a similar situation. Bring us back to the beginning here. What were the first few months like when you developed the sounds that were coming into your system?
Right. So the thing about my tinnitus, it started years ago in 2015. It followed a period of intense tension, muscle headaches that lasted for 7 months. And that's kind of when I started noticing the ringing in my ears. And then the next few years after that, I've had good years, I've had bad years, and I've kind of been all over the place trying to figure out what was causing this issue with my ears. I was seeing a lot of doctors, a lot of professionals, and I received many different opinions. And I did one of the worst things you could do throughout these years. I Googled, I went on forums, and I saw the worst stories from some people who generally weren't the best people to go to in regards to advice on tinnitus. And like I said, I've been going through this for years. I've had ups and downs. And it wasn't until recently, like 2 years ago or 1 year and a half ago, where after being pretty much habituated, that I started losing the habituation. I had had ear infection coupled with high stress from work, and then the noises just started getting louder. My anxiety started to increase, and then I can honestly say I lost my habituation. And that's how it was in a year ago.
Yeah. All right. So things started to slip away. And I imagine that there was this cascading series of things starting to build on each other. Looking back on it, what were the challenges there? What were the roadblocks? Was it the information? Was it not having a proper, solution? Was it not having the right diagnosis? Was it the going on the forums and going in those loops of anxiety? Talk to us about what you can see looking backwards so that we can bring some awareness to this so that those of us here who are listening can maybe be aware of that themselves or learn from what we went through.
Right. So the issue with me is that it's kind of a all of the above situation. So for years, I was kind of trying to be my own detective when it came to figuring out what was wrong with my ears. Because in the beginning, most people with this, they do have some issue with the ears, whether it's hearing loss or infections or things like that. And bouncing from doctor to doctor, I just had different opinions. I had one doctor say, "Oh, you have hearing loss," without testing me at all. He just heard tinnitus and said, "Okay, boom, hearing loss." And then I had other doctors say, "Oh, I have jaw problems like TMJ," which I do have. I have issues with my neck. One doctor prescribed me Meniere's medication, even though I have no history of Meniere's and I don't have Meniere's. And that was basically the foundation for all the stress and anxiety that would happen later on because I wasn't put in touch with the right professional. I wasn't put in touch with like up to date professionals, especially when it comes to tinnitus. And then throughout the years, again, I Googled. I Googled a ton of things on different forums. I joined Facebook groups. I followed the groups on Reddit. And these aren't professionals. These aren't audiologists. These aren't people who are qualified to treat people with tinnitus. These are just scared people like me at the time who were in a terrible state of mind, believed some strange things about how their ears would get worse. And it became like a vicious cycle, you know? Like I went from what's going on with my ears to, oh my God, I can't chew carrots because the noise of chewing carrots is too loud and it could damage my ears, which is actually something you can find on a certain forum. And it just kept escalating from there, escalating from there. When I was in university, when I was working, I was able to distract myself. Oh, I have tinnitus, but life goes on. But then, as I said, a year ago, when I was graduated, working hard, and just a bunch of different things happened at the same time. It was like the straw that breaks the camel's back, you know? It just led to this vicious cycle. And then during this vicious cycle, I developed hyperacusis purely from anxiety. I couldn't tolerate any noise, and now I'm doing great. And I just felt so hopeless, you know. And again, seeing the wrong doctors, seeing the wrong professionals, the ones telling you just live with it, deal with it. Oh well, this test shows nothing wrong, so there's nothing wrong, and there's nothing I can do. And it was just like one hopeless message out of the other. And I feel like many who are watching this, many who deal with tinnitus, can relate to me when I say even your family starts to get frustrated with you to some extent. So you feel even more isolated. And that was how it kind of led up to.
This is a short interruption from today's video to announce the tinnitus quiz. If you're watching this video, there's a good chance that you or someone you know has tinnitus. We know how much tinnitus can impact your daily life, and we're here to help. Visit tinnitusquiz.com and take a 2-minute quiz to receive personalized treatment plans that have helped hundreds of people learn to manage their tinnitus. Start now at tinnitusquiz.com.
I remember I went down a series of posts on a forum. And after about 45 minutes of reading and reading and reading, and it was almost like I was chasing something, like I was trying to find it. I was trying to go deeper into where is this leading to? Did everyone else miss something? Is the answer for my health inside of one of these forums or a clue? And that 45 minutes after it was over, I put my phone down, sort of similar to how I would go on social media, and it's almost like a mindless state of going deeper and deeper, and then I sort of snap out of it. And at that moment, my tinnitus, I noticed, was a lot louder. I think exemplifies this system between the limbic system, the psychological network of fear, anxiety, stress, and how that has connections or pathways to tinnitus, and how those systems can create these negative feedback loops or this vicious circle. I also want to credit that some of these forums are educational. They are giving information. They are helpful. They can build a sense of community. So we're not here to say that they're all bad, but just to say that, unfortunately, given the nature of someone who doesn't have the right answers or help for tinnitus, it can often be not in your best interest. It can be a net negative to go and pursue further information. That said, I think a lot of people find me and they find Treble Health, they find what we're doing online as well. So of course there are good information, there are reliable information sources. But I just want to say, George, that I'm sorry you went through that, and it's, no one should have to go through that alone. And I'm glad that we can be meeting here today to talk about some of the wins, some of the successes that you eventually found. Talk to us about those turning points. You had mentioned that your tinnitus has a cause of somatic or somatosensory factors. So talk to us about this turning point of what allowed you to find the right resources and get the right help.
Right. So just to refer back to the other thing, as you said, those forums did help, because I wouldn't know about somatic tinnitus if it wasn't for those forums. I wouldn't know that tinnitus could be caused by the jaw, by the neck, by stress, by anxiety even. And to be honest, all of these play a factor in my life. But the danger of that is you can also like just walk by the answer because you're going too deep into a rabbit hole. You ignore what could possibly be your cause. And that's why I want to get back. I want to talk about Treble Health, where I did start to notice videos from Treble Health years ago. And I will admit, I wasn't following them up when I wasn't following up on them or watching too many of them when I first started, because again, I was going into the rabbit hole of anxiety that is like online forums. But then as time went on, I started to watch your videos. I started to watch your success stories. I started to watch your explanations of what was going on. As you said, the connections between anxiety and the increase in the volume of tinnitus. and how like the most important part of that was like your message, which is, you know, you don't have to just live with it. It's not something you're stuck with helplessly. There are things you can do. That kind of started happening to me 3 to 2 years ago. Like I said before that, it was like fluctuating. And it was actually your videos paired with another YouTuber called Tyrone Magnus that kind of clued me into the somatic component of my tinnitus. I first saw Tyrone Magnus's video where he was talking about like how he would go to physiotherapists, acupuncturists, and focus on his neck and stretches. And then I remember watching your video with the German doctor.
Dr. Michael Gollenhofen.
Yeah, that's the second time you're telling me, and I still can't remember that name. And it started making sense. So I went to dentists to get a mouth guard. I even got my wisdom teeth removed, and that did lower the volume a bit, but the tinnitus was still there. So I started seeing physiotherapists. I started doing the advanced tests recommended by you guys when you see an audiologist, like testing into the extended frequencies. And I started slowly getting better and better. I wasn't perfect right off the bat, you know, it wasn't like suddenly I'm great, but I started going towards getting in a better place, better state of mind. And again, as I said, a lot of stress happened at the same time, and then I went crashing down again. And then I decided to finally take the leap and contact Treble Health because I started enjoying your videos more and more. I found it more helpful, and I enjoyed seeing what I saw in those stories with your patients, where they're the worst case scenario, like a heavy degree of hearing loss, or they're dealing with way more struggles than I am, and they feel better at the end of it, or they feel better during you guys helping them. So I contacted Treble Health. I got a 15-minute conversation with your brother there, your brother Garrett, and that was helpful right off the bat. He started looking at the tests I had so far, and he was like, "Yeah, it doesn't look like hearing loss, but maybe we can pair you up with someone who can really dig into this." And that's where I got paired up with Dr. Mark, and frankly, he's amazing.
Tell me more about that. What happens when someone really digs into it?
So, well, if you dig into it by yourself, like I did, you can end up in a pretty terrible place. Just want to say that. But then when you have a professional like Dr. Mark, and I even saw a couple of other audiologists, Hania and Michelle, who were, you know, they were young. Like Mark and Hania and Michelle, they were young audiologists. They were up to date on the latest studies. They didn't dismiss the noise in my head. They didn't like give me such a hopeless outlook, especially Mark, when I like who would actually like answer my questions. Because, you know, with Treble Health, you can email them and they will answer your questions, which was something that was hard for me to find with other doctors who frankly were impatient the second you leave the room. So Dr. Mark would look at my tests. He would say, okay, well, you know, there's a strong chance of a somatic component to this. I would really recommend you go into physiotherapy, find a good physiotherapist. And he gave me hope, you know, like he let me know there's something to do regarding it, because I believe you saw my hearing test. It's very unlikely that my ears have anything to do with my tinnitus. It's mostly jaw, neck, anxiety, and stress. So he kept anchoring me to that fact, you know. He kept me away from the forums. And a big part of that was he would answer my questions. He would answer them patiently. He wouldn't like simplify the matter. Like he wouldn't give me like, oh, you're fine, that's it. No, he would go in depth and tell me, oh yeah, I wouldn't worry about that noise because, you know, as you go far away from the noise, the decibel is much less and less. So you know, the noise may be loud, but certainly not loud enough to impair your hearing. And not just when it comes to noise, when it came to infections, he'd be like, oh, it's normal to feel this. And people experience infections all the time, but it's highly unlikely can do anything. He really kept me anchored when my mind was just ready to assume the worst. And of course, when you assume the worst, you get more stressed, the tinnitus becomes worse. And like I said, I was going through hyperacusis throughout this time. So I started becoming, and this is something I noticed on the forums, I started becoming afraid of noise. I started becoming afraid to leave my house because I was afraid a car would honk right next to me. I started being afraid to go to restaurants because I was afraid someone would drop a plate and it'd smash and it would damage my ears. And that's a paranoia I see everywhere on the forums. I don't think it's just me. And like I said, my ears couldn't tolerate noise anymore, even though there was no like damage. It was more my state of mind. And this would go on for months. Like, I'm not going to say I felt great right away when I had Dr. Mark assigned to my case, but a lot of his recovery was due to him. And it was due to the other audiologists like him who were like young and up to date. They didn't make me feel hopeless. I would get hopeless online, and then they would bring me back to the present and let me know I could get better.
Mm. And George, tell us about your progress over time. What did you notice in terms of the awareness of tinnitus, as well as perhaps the volume of tinnitus? How did that or did that not change over the treatment period for you?
So for me, in my case, the volume is always fluctuating. And again, that's a cue to what could be causing it. Because if I do this, it increases here. If I do this, it increases there. If I spend all my time hunched over my desk working, which I do a lot because I work from home, it increases throughout the day. And even there's been times in the middle of the night where I've woken up and it sounded like rocket launchers in my head because I slept crooked and then went back down when I massaged and everything. So it wasn't really about, for me, it wasn't really about lowering the volume, but Dr. Mark's clues kind of made me adopt better habits, which over time did lower the volume. It was more about my mental health, my anxiety, and like getting me to a place where it wasn't affecting my daily life.
Yeah. And
habituation.
When there is fluctuation in the volume or the perception of tinnitus, if that's a consistent fluctuation, then one of our approaches is often let's reduce the intensity of the fluctuations and let's focus on just keeping your baseline in check, because most people can manage their life if they only had their good days, but if they mostly had good days, it's the bad days, it's the feeling out of control of these fluctuations that can often create a lot of these problems. So tinnitus is a condition sometimes of margins where we may take a 40% marginal improvement, and that can really impact someone's life in a positive way. Most of the time, the tinnitus is not going to go down to zero, but we must remember that millions of people live with mild tinnitus, including myself. So I think those pieces are important. And you've put in a lot of work. Of course, you've put in a lot of dedication to practicing these tools, practicing the techniques. Where are you today, and what are you focused on here in the next few months in terms of your own health and your ears?
So where am I today is in a much better place. The hyperacusis I mentioned is almost gone because I truly believe it was anxiety related. Whereas before I was afraid to go outside for fear of a honk, for fear of screeching brakes, just loud people. I walk outside in the city daily. I'm not going to say I'm 100%, but I'm in a whole lot better place than I was before. Because what I will say is Dr. Mark and Treble Health, by extension, gave me the stability I needed to kind of get better on my own. So that's part of it. The other part is like, because I do believe my tinnitus has more of a somatic component to it and an anxiety component to it. I'm seeing physiotherapists. Okay, maybe it's not happening in this video. Maybe I'm slouching, but I am trying to work on my posture, and I am trying to focus on the mental health so that not necessarily my tinnitus, but that's so I can get better and continue on with my life. And frankly, the positive stories I do see on this YouTube channel does help with that.
Yeah. George, we want you to take this message, keep up the good work. Thank you for giving back and sharing your story. I think for anyone who has somatic tinnitus or is wondering if their jaw, TMJ, neck conditions, posture could be a factor, you got some helpful tips listening to George's story, and also some sense, some information, some guidance here of be mindful about where we put our attention. Tinnitus gets louder with stress. Tinnitus gets louder or more intense with anxiety. So anything we can do to be aware of how we might be getting in our own way of healing, of treatment, of help inadvertently, just being aware of that can be really impactful. And then finally, the tools that are out there need to be customized for the individual, right? How sound therapy can be helpful, but in the case of somatic tinnitus, it may not be the principal or the primary treatment. because the physiotherapy adjustments, the posture changes, the TMJ piece of it is more directly treating that cause. So for those who have resources, please do reach out to our team at Treble Health to get help. Like George says, we do have free consultations. You can speak to an expert from our team. And for those who want to or need to manage this on their own, try to get your information from trusted sources. George, I'll give you the last word, and I thank you for being here.
Thank you so much, Dr. Ben. If I could give a hopeful story, and this is something, again, I learned from a video I watched on this channel where one of your patients recorded every improvement. So when things were bad, she could see that, hey, there was a good day. Now I was bad with the physio, so my tinnitus is kind of going back up again. But a year ago, when I was following the physio, when I was really going intense with it, and also when I was in a better place, there was 3 moments, and I call them moments, they weren't that long, where I really tried. It was hard, but I really couldn't hear my tinnitus. Like I plugged my ears and I struggled to hear them. They were 3 quick moments, but again, for people with somatic tinnitus, it gave me a lot of hope that I could actually maybe not get rid of it, but do a lot to reduce the volume when it comes to somatic tinnitus. And also, this is something important I want to say. I really want to thank Dr. Mark, and of course, through by extension, Treble Health. I really want to thank Dr. Mark because he was very patient with me. He was very understanding. He wasn't dismissive, and he put a lot of effort into answering my questions. He was a big reason. He was a big cause for my recovery. I'm very thankful to have found him through YouTube and through you guys. And the other people I want to thank is, as I mentioned, Hania and Michelle from Huri Clinic in Dubai. While I was also seeing Dr. Mark at the same time, they also were very patient and understanding and very up to date with their knowledge of tinnitus. They helped me get to a better place. And they were also part of my recovery. And also a big thank you I want to say is to my dad, because to be honest, while a lot of my friends and family they were kind of tired of my situation, my dad was there from the beginning. He's a veteran, he has tinnitus, and he was really patient with me, and he was one of my biggest advocates through my recovery and my ongoing recovery today. So those were the people I want to thank. And of course, I want to thank you, Dr. Ben, for having me on and allowing me to share my message.
Yeah, of course. George, thank you so much. I hope to have you on again in the future to give us an update of how you're doing. And for everyone who's watching, please comment on YouTube, helpful, if George's information was helpful here today. My name is Ben Thompson, and I'm here with George, and we'll see you soon, everybody. Bye-bye.
Take care.